There are so many men's health clinics all over the country. You can't get online without seeing something about how it's going to make your erection bigger and all that. And, that's wonderful that men have resources, but there's really such limited stuff for women, and the focus is just not on the women at all. But how much of that is because of our limited knowledge? You said we do know quite a bit, but I think when we look at the science and what we have, where do you think we are with respect to the science, and where can we be moving forward to understand more about what causes some of the problems of women, and then ergo, how to fix that?
Yeah, I mean, urologists and physicians in general, we're in the same pool that everybody else is in. And what that pool is a really crappy sex education system, right? We got a disease and pregnancy prevention plan. We never learned to communicate. We never learned that there would be roadblocks and bumps and difficulties, right? So we are just as awkward. And most medical schools, and there's data on this, most medical schools do not provide good training in how to communicate to patients about sex. So it's awkward for everybody. And doctors really haven't done a good job of making up for the deficiencies that we got along with everybody else in terms of sex ed. So really talking about the bias of do we let women be sexual? Are they sexual beings? Do we think it's a problem when their sex life is different than it used to be? Do we judge them differently than we judge men? And really thinking, even the biopsychosocial, right? For once Viagra got invented, this was a blood flow problem. And we really ignored the relationships, the stress, the anxiety, the performance anxiety, the stress that can affect erections, right? We kind of really made it biologic. And I would argue in the female domain, and again, I'm oversimplifying, but we really make the female domain you're just stressed, you're just anxious. And it couldn't possibly be a blood flow problem, couldn't possibly be a side effect of your diabetes, couldn't possibly be a side effect of your antidepressants, right? We've taken the biologic out of women and made it all about their brain. And so really making sure we're thinking of both humans in the biopsychosocial realm.